name's Christine. I'm gonna be the nurse today for you. I have an assessment to do on you, okay?
Okay.
So I'm gonna start with cardiac and neck vessels. I have a few questions regarding cardiac history.
Okay.
Do you have any, like, coronary artery disease or diabetes in your family?
No heart disease, but yes, diabetes.
Okay. And are you a smoker?
I am not.
Alrighty. So I'm going to start with the heart part. So looking at your chest, I'm going to like palpate around the precordium, which is a part of the chest that overlies the heart. So it's right around here. I don't see any pulsations around there. I don't feel anything. And then noting the point of maximal impulse, that's fifth intercostal space, it's midclavicular line. So it would be right around here. And then I'm going to listen to your heart sounds. So I'm going to name the 5 heart sounds. I'm going to start with my diaphragm, and then I'll listen with my bell. So this is the aortic area, second intercostal space on the right side, and then to the left of that second intercostal space, this is a pulmonic area. And then third intercostal space on the left side, this is Erb's point. And then the tricuspid area, fourth intercostal space, and it's on the left side. And then the mitral area is fifth intercostal space, and this is midclavicular line. So S1 and S2 are noted throughout. I didn't hear any extra heart sounds. There aren't any murmurs. S1 is the loudest at, it's the apex of the heart, which is the bottom of the heart. It's the fifth and sixth intercostal space. And S1 is the closure of the AV valves, which is the tricuspid and the mitral. And then S2 is the loudest at the base of the heart, which is, S1 is the closure of the semilunar valves, which is the aortic and pulmonic, and that's at the first and second intercostal spaces. Alright, so now with my bell, I'm going to go through the same spots. So aortic, and pulmonic, and then Erb's, and tricuspid, and mitral. Okay, so I'm going to have you lay in left lateral position. So this part of the assessment, I am seeing if you have an S3 heart sound that's audible. This is for like mitral stenosis. So lying like this brings the left ventricle closer to the chest bowl, which makes it more audible in the stethoscope for low pitch sounds. So I'd have it at the point of maximal impulse. So I'd put the bell lightly here, and then if there was an audible S3 heart sound, I would be able to hear it right now. And I cannot hear anything, so that's a normal result. So I'll have you sit up now. And now for assessing the carotids, so I'm going to palpate your carotids. It should be right around here. It's like midway at your neck. it's 2 plus, and I don't feel a thrill, which would be like vibratory sensation. And that's 2 plus as well. And then with my bell, you'd inhale and then exhale and hold that. And then I put the bell there. And then on this side. So I hear a strong pulse. If there was a bruit, there would be a swishing sound, and there was no bruit noted. So now moving on to thorax and lungs, I'm going to ask you respiratory questions. So you said earlier that you weren't a smoker. Have you had asthma or bronchitis or anything?
As a child, I did have asthma, and then several years ago, I did have bronchitis.
Okay. Alright, so looking at respiratory rate, so he doesn't appear to be short of breath. He's not rapidly breathing. He doesn't look like he's in acute respiratory distress. His chest is symmetrical. His anterior-posterior ratio to the transverse is 2:1. His posture is upright. He's not like tripoding. I don't see any pulsations. And now I am going to palpate for chest excursion. So I'm going to have you turn this way. Yeah, right like that. So this is respiratory excursion. So you go down to about the 10th rib, and I'd have you breathe in, and then out, and breathe in, and out. Okay. So as he's inhaling, they rise equally and it's symmetrical, and then when he exhales, they go down at the same time as well. And then for tactile fremitus, so this would be palpating posterior as well. So with this, you do like the palmar part of your hand, so I'll have you say 99.
99. 99. 99. 99. 99. 99.
Okay, so you can feel the vibratory sensation when you place your like palmar aspect of the hand there. So that's a normal result. And then I am going to percuss posterior. So with this, you want to be like between the ribs because you want to hear the resonance, which means that it's air filled. Alright. So if you go over bone for this, you would hear a dull sound. Alright, and then I'll have you come forward here. So now I'm going to listen to the breath sounds. So there's bronchial breath sounds, which I'll listen to them at the trachea, and then there's bronchvesicular breath sounds, and that's like the first and second intercostal space, right around the sternum. And then the vesicular breath sounds, we'll hear anterior, posterior, and laterally. It's the periphery of the lungs. The right lung has 3 lobes, and then the left lung has 2 lobes. So I'll listen to the two sides here, and then 3 points on this side. Alright, so I'll have you breathe in and out. And again. Okay, I'll have you lift your arms to the side. So breathe in and out. And again. And then on this side. Okay, and I can have you just stand here. And I'll have you come this way. So, deep breath. And with a deep breath, with this you want to make sure that not going on the scapula. Okay, so now I'm going to do this assessment called agaphony. So what that is you're going to say E.
E.
Say it again.
E. 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 E.
Okay. So that was a normal result. An abnormal result would if you would hear A instead of, so he's saying E and I can hear E in my stethoscope. Okay, so I'm going to have you sit back down here. So now I'm going to do like the head, face, neck, mouth, and all that. Alrighty?
Okay.
So looking at his head, I see like the size, shape, it's normocephalic, it's symmetrical. His hair, there's distribution throughout. You see there's like some balding right here. I don't see like any dandruff or anything like that. And then palpating it, do you have any tenderness?
No.
Alrighty, and I don't like feel any lesions. Looking at his face, so symmetry, facial expressions. Can I have you smile, and then frown, and puff your cheeks? Alright, so that's symmetrical. Now I am going to have you, so now I'm going to assess your neck. So I'm going to have you go like this, and then forward, and then look both sides, and then go this way and that way. So full range of motion with your neck. And then we'll do like against resistance, so go against my hand in this way. So he has against resistance with my hand as well. So now I'm going to have you push up to my hands and then just shrug your shoulders and go like this. So shoulders, full range of motion, and against resistance. So his trachea, it is symmetrical. I don't see any deviation. Now I am going to palpate your lymph nodes. So I'll start here. So this is posterior auricular, and then we have pre-auricular, and back here is occipital, and when we get up here, this would be submandibular, and this is submental. Back here is the tonsillar. So then when we go down here, we have the superficial cervical chain, and then there's the deep chain. And then when we get down here, we have the supraclavicular lymph nodes. So they're all non-tender, and it would be abnormal to have like a tender, large lymph node, but all that was normal. So now looking at your mouth, I see that your lips are pink and they're moist. I don't see any like dry or cracks on his lips. So now with opening your mouth, and you can open a little wider. So the oral mucosa, it's moist. I don't see any like candidiasis. There's not any like thrush on the tongue. Teeth are intact. The gingiva, they're pink. There's not any bleeding, and open wide. The palates are intact. They're pink and moist. Can you stick your tongue out and then put it side to side? So tongue has full mobility. Alright. So now with the jaw, I want you to open up your mouth. Okay. Open wide. There's not any cremitous noted. And can you put your jaw side to side? So there is full range of motion. And now, so with the sinuses, so there's frontal sinuses, and then there's maxillary sinuses. I'm going to palpate the maxillary sinuses. Do you have any like pain or tenderness?
No.
Okay. And any right here?
No.
Alrighty. So at the frontal and maxillary sinuses, there's no pain or tenderness. So the nose, it's symmetrical. I don't see any deviation, and it is midline. I'm gonna have you close one nares with your finger and breathe in and out, and then with your other one, breathe in and out. So both nares are painted bilaterally. And I think that's about it.